Overlooking acid reflux disease in children. An 11-year-old boy in Boston developed gastroesophageal reflux disease, GERD, according to his mother Kathy. It was the end of June of the year 2005 when her son developed a cough which usually happens during sleep, and even during daytime. It is only a short dry cough symptom. His pediatrician thought it was only an allergy. However, his son was tested. The result showed that his son had no allergies. According to her, it was her son's asthma that was related to the GERD. Studies show that GERD is likewise normal to infants and children, like in adults, though this fact is oftentimes being overlooked. The symptom comes from continual sickness, coughing, and other respiratory troubles. Children are often vulnerable to GERD because of their immature digestive system. The truth is, majority of infants grow out of GERDs once they reach the age of 1 year old. The medical specialists further state that the symptoms of children may come in difficulty in swallowing foods or failure to grow. The doctors recommend that in situations like this, the best is to lessen the amount of acid in the children's stomach before it could lead to acid reflux, since the disease is not very curable in children. However, doctors suggest that some approaches to avoid acid reflux in children. An example is burping the infant quiet a few times during the feeding, or letting the infant stay in an erect position for 30 minutes after nourishing. Although for children aged 3 and up, doctors suggest to keep them off from sodas that include caffeine like soft drinks, carbonated drinks, spicy foods like peppermint, acidy foods like citrus fruit, too much chocolate, and fried and fatty foods. Ideally, establishing a healthy eating habit diet can really decrease the acid and the reflux in children. It also suggests that children will eat smaller meals before sleeping. If possible, do not allow them to eat 2 or 3 hours before sleeping. Also, elevate the head on their bed at least 30 degrees. Further treatments include the use of H2 blockers. This is available in any drugstore. Prefidase C, proton pumps, inhibitors can also be used in treating acid reflux in children. However, if these treatments fail to stop the symptoms, other treatment methods need to be done. It is very atypical, but a doctor's recommended surgery. This is so far the best treatment for the relentless symptoms which do not anymore counter on other treatments. The esophageal reflux surgery for children is designed for children who have had unsuccessful medical treatments. Continuous surgery is essential as the child grows. Now, if you get confused whether this is time to consult a pediatrician regarding the acid reflux, the answer is observe the amounts of vomiting of the child. If it already comes out in green or yellow or appears to be like blood or coffee grounds, there is difficulty in breathing and vomiting, there is pain in swallowing, immediately consult a pediatrician before symptoms get aggravated. So to prevent the occurrence of this disease, stay away from the habit of leaning forward after eating, or worse, sleeping after taking a large amount of food. Take a note, advanced acid reflux disease has a great possibility to end in serious medical complications and may lead to hospitalization. Be keen of the possible symptoms so not to overlook it. Take care of your kids.